Do I click on admit?
I'll take care of that too.
Okay.
All right, great. So thank you everyone for joining us today, whether you're on Facebook Live or on Zoom. Please feel free to add your questions on the chat box as we go through. All of them will be answered toward the end of this session. I'm very excited to have our partners Horizon representatives here today to talk about health insurance and how important that is, especially during the times we're experiencing right now. So I will invite you all to learn more about all of the health events that are happening in Plainfield and surrounding communities by visiting the social media page on the Healthy Plainfield Coalition or at www.uwjuc.org. There are plenty of upcoming events that will be happening this month. Without further ado, I'll let our two amazing representatives introduce themselves and talk about this great topic. So, go ahead.
Okay, I'll go first. My name is Evelyn Acevedo, and I'm the Community Health Manager at Horizon NJ Health. Hi, everybody.
Good afternoon. My name is Elisa Carrero, and I'm the Community Health Rep for Horizon Blue Cross. Okay. So you want us to start the presentation, or should we just give it a few minutes?
Hi guys, I'm on too. This is RG.
Hi, RG.
Hi. So yeah, my name is RG Morel, Argelis Morel. Everyone calls me RG. I am a representative for Horizon and account manager for the individual consumer markets on the Hispanic side.
Thanks, RG. Okay, I think we're ready.
Go ahead.
No, go ahead.
So today we're pretty much here to explain to you how New Jersey Family Care is pretty much set up and how we can do applications, how we renew them, what the process and pretty much how everything breaks down. If you have any questions or concerns for me, obviously I'm a representative for government programming. So if you have any questions, you can definitely reach out to me. And my number and my information is contacted below. Next slide. Oh, sorry. Let's start with New Jersey Family Care. Sorry. So the basics of New Jersey Family Care. New Jersey Family Care is New Jersey's public health care coverage program, which includes free or low cost quality health care for adults and children. It includes Medicaid with the Children's Health Insurance Program, which is also known as CHIP. Once you are approved for New Jersey Family Care, you will need to assign your HMO. Your HMO is your health management organization. This is the organization that provides your health insurance coverage to the member. Normally, when you completed your application, the EDA, which is your eligibility determining agency, will determine your eligibility, excuse me, and this will be by your state or your county social services. It all depends on how you apply. Also, if you're going through the county Board of Social Services, this is your county welfare office. This is where you can also apply for NJ Family Care. Next slide.
Okay. Can you see it?
Hold on. Yeah, there you go. Okay, how to apply. So how do you apply for New Jersey Family Care? There's a few ways. You can go onto njfamilycare.org. You can give them a phone call to your state regional office, which is 1-800-701-0710. You can visit your county Board of Social Services to apply for NJ Family Care, or you can contact a community health rep, which is what I do. So I can assist you in completing the application online. From that point forward, you'll be able to choose your HMO. We will do the application. You can choose your HMO. Next slide. Once you do your application, you're going to have your information sent over to the state, and they'll be sending your information to your EDA. They're going to request more information from you. It normally takes up to about 45 days. The information that they normally are requesting is proof of income, identification, proof of address, And from that point, it takes about 45 days. And from there, you will receive a letter from NJ Family Care requesting, you'll receive a determination letter. Sorry, got a little sidetracked. Next slide. So you'll receive your determination letter to inform you if you have been found eligible. If you are not, and you are found, you would get a denial letter. You do have a right to appeal. That letter will include instructions on how to appeal. Also, if you're approved, the effective date of your NJ Family Care eligibility will be included in that letter. You will also receive an enrollment letter with the effective date of your HMO. And don't forget to renew it or lose it. So that basically is when you have to keep your benefits in order, which is on a you have a yearly renewal process. Every member's case is different and changes do arise. So try to keep your information up to date with your EDA. And if you do have any changes or you're unsure of your renewal date, you just give the state a call, and it's 1-800-701-0710. Next slide.
So I just want to jump in really quick. This is really important, this piece right here. Once you have coverage, you need to make sure you keep track of the date that you enroll. If you're unsure, things happen, you forget. You can always contact the state, New Jersey Family Care, or you can also call the county, Board of Social Services, and they'll let you know what that renewal date is. It's really important that you pay attention to your mail. A lot of people might perceive it as junk mail and throw it in the trash, but the majority of the time the renewal application is sent via mail. So please make sure you keep a lookout for it, okay?
Words to know. These are some keywords that you should become comfortable with, understanding your benefits, premium, co-payments, a specialist. I'm sure that a lot of you already know what these words are, but these are definitely some words that are going to come up in the previous. Next slide. Okay, your provider network. Your provider network means your doctors, your specialists, facilities that participate with Horizon NJ Health. When you are out of your network, that simply means that those certain doctors and hospitals do not accept Horizon NJ Health. But pretty much, you should be able to understand what's your provider network. Next slide. And if you're having issues looking for your doctor, you can always go onto horizonnjhealth.com. Contact member services, which is on the back of your card or your insurance card. That number is 800-682-9090. Or you can request your member directory from member services from that same phone number. Next slide. As I said, you can call member services with any questions at any time, day or night. Our member services department is a toll-free number, and someone is ready to help you 24 hours a day, 7 days a week.
Okay. And also additionally, there's other important numbers that may be of use to you. These numbers are also available in the member handbook and also on our Horizon NJ Health website.
Your benefits overview. Let's see. Okay, for those who are already covered or are interested in applying, the first card is what you're basically going to be getting for Medicaid and your Horizon NJ Health card. That's your HMO card. They'll give you access to your doctors, your specialists, your pharmacy. The second row is your MLTSS card. This is for members in need with long-term care or full-time nursing assistance. If you have more questions or concerns, we can discuss this after the presentation, or we can just contact one of us from Horizon Blue Cross. The last line is NJ Total Care. This is a part of a Medicare Advantage plan that includes services for Medicaid and Medicare services. Evelyn, I don't know if you want to.
So for the New Jersey Total Care Plan, if anyone wishes to have any more information in regards to that, we can connect you to a sales representative who will be, more knowledgeable and be able to share any additional information regarding the Total Care Plan.
Okay, and how to read your Horizon NJ Health member ID card. It's pretty basic. It's your first name, your last name, your policy number, your primary care provider, And your issue date, effective date. If you have any co-pays, will also be on that side. On the back of your card will be your member services, which is on the back. That's 1-800-692-9090. Pretty much self-sufficient and pretty easy to read. Next slide. Your benefits and services. Horizon NJ Health covers a variety of medical services. Obviously, your routine physicals with your primary care provider, dental cleanings, oral exams, and routine eye exams every 1 to 2 years based on your age health. Next slide. Okay, programs for you and your family. Offers a Horizon NJ Health provides a variety of programs for you and your family to make sure you're getting the best from your benefits. It's important to check your updated member handbook or contact member services to make the programs available as changes occur. Remember that these programs serve as a resource and may not be provided by any other HMO. Ev, I know you have.
I just wanted to add on, for example, our Mom's Gems program is a great program available for mothers that are expecting. This is just our case managers who stay in touch with them, making sure that they're getting the care that they need for a healthy pregnancy. Any questions that the expecting mother would have, the GEMS nurses would be there to help them with anything at all, as far as going to the right specialist, if they need to go and get the ultrasound, where to go, if they're having issues with their prenatal vitamins, or if they're feeling a certain type of way. These case managers are awesome, and they'll be there to help them, step by step. So there's a lot of pregnant moms that are unaware of this program. So we're sharing this with you just to, if you are interested, make sure you call member services, because they can help make that connection. And then as you can see, the other programs that we have available: case management, disease and management. They help you with any issues such as asthma, cancer, mental illness, you name it. Those case managers are there to help. If you are interested in getting more information on care management, we can definitely make that connection for you after the presentation. We'll give Elisa's information, and we'll definitely make that connection for you. And these are just a little bit of what we have. There's additional programs available as well.
Thank you, Evelyn. This next slide is our member handbook. This is a helpful tool also when looking for what your benefits consist of, or what's good for you and your family, if you have any questions. And you can always access this online on Horizon NJ Health. Next slide. Oh, and also call member services, 1-800-682-9090. So your rights and responsibilities, so you basically have your basic rights. You are able to obtain medical care. You have your choice of specialists. You can ask questions in regards to your health. You have no discrimination in care, and you pretty much have the right to appeal. So if you're unhappy with something, you have the right to say these things and explain yourself. And you can change your doctors. Nothing is holding you to be with a certain doctor if you're not happy with your care.
Absolutely. If you have a current provider that you're not happy with, you are more than able to call us to let us know. You can file a complaint. You have the right to choose whatever primary care doctor that you choose to go to, as long as they're in network with Horizon NJ Health. And if you should happen to find a doctor that is interested in getting in contract with us, we will definitely help make that connection and bring that doctor, get them credentialed so that you can have that doctor that you would like to go to. Same thing for specialists. When you go to your primary care physician, they usually supply you with a list of specialists that you can go to. You don't have to feel obligated on going to those specialists. If you already have one in mind, again, as long as they're in network, you're more than able to go. And just a reminder, there's no referrals. You do not need any referrals to go to specialists. I'm very happy to say that. And these are just some additional rights and responsibilities that you may not be aware of, and we wanted to make sure that we pointed it out to you. Okay.
Okay. Some reminders. Make sure that you keep your information updated with New Jersey Family Care, which is with the state or Board of Social Services. Always make sure that you renew your NJ Family Care benefits every year. And also that Member Services is available 24/7 for any questions. And you're not alone. We are here for you. So just thank you. Thank you for your time. And I'm going to hand it over back to Evelyn. If you have any questions, please feel free to give me a call or text or email.
So again, these are just reminders that we thought would be helpful. Definitely when you're moving from one address to another, it's very, very important for you to stay in touch with New Jersey Family Care or the County Board of Social Services so they can have that information updated. It then comes down to us electronically overnight and will be updated in our system. So if you find that you call Member Services and you want to change your address, they're going to redirect you to New Jersey Family Care or Board of Social Services. And the reason being is if we go into our system and we make that change, it'll automatically go back to what New Jersey Family Care and the Board of Social Services has, which would probably be the wrong address. So we want to make things as smooth as possible for you and get you in the right direction. So again, if you have a change of address, phone number, maybe there might have been a misspelling in your name or the wrong date of birth, New Jersey Family Care and the County Board of Social Services is definitely where you definitely want to connect to get that corrected. And if you're unsure of the County Board of Social Services, the phone number and the location, again, we can definitely make that connection for you. And here's some numbers that we went through the presentation. We wanted to share it with you again. These are different ways for you to get in contact to get the help that you need. And Elisa will also be available to assist. And here's her information. You can reach her via email, and this will be her business cell phone number. Feel free to call or even text. And that's it.
I can always put it in the chat if necessary.
And this is it for the English presentation. Tanya, I don't know if you want to let me know when you're ready for the Spanish.
Yeah, thank you. That was really great information. We do have about another 12 minutes in the English version, so the Spanish will start at 3:30.
Okay.
But there were a few questions that came about. The first question is, what is an HMO?
So an HMO is your health maintenance organization. That basically is the insurance carrier that is taking care of your insurance health needs.
Yep.
Okay, thank you. The other question says, what can you tell us about the Medicaid enrollment period during the month of October, and how does it work?
So Medicaid is from October 1st till November 15th. That's our open enrollment. That's if you need to make any changes with your, pretty much with any of your, with your actual insurance company. Even though you are allowed to make any changes throughout the year, this is when it's most easiest to make any changes if necessary.
Right.
Okay. Another question says, what advice would you provide someone who does not have insurance? How would they know what type of insurance they would be able to qualify for?
The first few questions I'd ask is if they are a resident of one of New Jersey and United States. If they are they currently working? The size of their household. And that's pretty much it. And depending on those questions, the answers to those questions, that can determine whether they qualify for Medicaid. If they do not qualify for Medicaid, we can refer them over to the marketplace, which is where our Jealous is in the line. She may be able to be of assistance as far as applying for the Affordable Care Act between November 1st and December 15th, which is their open enrollment.
And I just want to add, let's just say the person isn't eligible for coverage either with Medicaid or with the Affordable Care Act. We refer them over to a federally qualified health center so that they can get the care that they need.
Thanks, Ev.
Excellent, thank you. Another question says, if we have additional questions and we reach out, does that mean that we are choosing Horizon as our insurer?
Not at all. I'm completely unbiased. If you have any questions or concerns, I can definitely answer them for you. And along with, if you need to apply to and you want to choose a different HMO, you're more than able to. It's fully your decision, not mine. So I'm just here to assist.
Thank you. And the other question says, what are the required documents to bring when I make a visit to get assistance?
I need some identification, preferably, obviously, your name, your address, or current address, your social, and some information as far as what your income is, whether it's on a weekly, bi-weekly, monthly basis. That's pretty much it.
So I just want to add that at the time of the application, all we do is ask the questions. The application is done online, and we just ask them the questions that are presented to us by New Jersey Family Care. It's on the NewJerseyFamilyCare.org website. So, you know, it's not questions that we're coming up with. It's the New Jersey Family Care questions. And so we're just taking the application and helping that process for them. And then what we do is at the end of the application, we let them know the documents that are going to be needed in order to for the application to process successfully. So when they come to us with those documents, we just make copies for them just to make it easier for them. And then that way, when New Jersey Family Care sends something in the mail requesting the documents, they're ready to go, put it in the envelope and send it in the mail. And again, I just want to reassure that we do not determine eligibility. I want to make that really, really clear. At the end of the day, it's the state and the county that determines the eligibility. The only thing that we do is administer the benefits.
Okay, those are the questions I have seen so far. Are there any individuals who are either on the phone or that would like to ask any questions? I'm going to go ahead and try to unmute everyone at this point. So feel free to jump in.
So I just want to remind everybody that we do have someone from our individual plan and any questions regarding our Affordable Care Act, our Jealous would be more than willing to answer any questions that you may have.
Another question just came in. So it says, if I have been rejected from Medicaid in the past, does that mean that I'm going to be rejected again?
Absolutely not. It's based off of if their denial is due to income and their income is significantly lower than what it was, there may be a possibility that he or she will be will not be denied this time around. But it doesn't hurt to try, see what happens.
I just wanted to add, if you want to check to see if you're eligible, you can definitely go on NewJerseyFamilyCare.org and click on income. You'll see it there on the left side. It'll show you the income requirements. So,
And if it's,
go ahead.
And if it's not due to income, if it's due towards residency, you do need to be a resident, a lawful permanent resident for 5 years in the state of New Jersey to qualify.
Right, and if you do not meet that 5-year requirement and your income is higher than what is deemed under the family care income guidelines, then you would at that point be qualifying for enrollment through the individual market, which is through Get Covered New Jersey. We just moved from a federal exchange into a state-based exchange. And then at that point, you can connect with one of the representatives or the account managers like myself to look for coverage options under the individual plans. And our open enrollment starts November 1st, and it's actually extended into January 31st of 2021 this year. And that's because we work together, Elisa and Evelyn, as well as my team. If they do encounter someone that does not qualify or meet those requirements, they will kind of send us the information at that point by the person. If they want to be contacted by one of us, they can, and we will then go over all the information related to getting coverage on the individual marketplace.
Excellent, thank you. The other thing is, I know that we were trying to reach out to the Plainfield community. Something I wanted to kind of just bring up again is the partnership being discussed with the Plainfield Neighborhood Health Center, where there will be assistance provided on site by some of the Horizon staff and some of the health center staff for individuals who are looking for assistance to figure out either whether they qualify for Medicaid, the health insurance marketplace, or charity care, which is which kind of embraces everyone else who doesn't qualify in any of those two buckets for insurance coverage. So not insurance coverage, sorry, for medical services. Are there any other questions from those individuals who are here? All right, well, hearing none, thank you everyone for joining us this afternoon. Just a reminder, this session is recorded and is being shared live on Facebook. We will have the Spanish session at 3:30 p.m. We look forward to seeing you there.
Thank you, guys. Great presentation.
You are so welcome. Thank you.
Thank you for having us.
So at this point, I think we might just kind of wait it out a little bit, unless we would end it and restart. I think we should just continue. We'll give it a couple more minutes and, we'll do it right next to it.
Do you want me to put the information on the chat box, or do you want me to wait, till the end of this session?
What information is that?
Excuse me?
What information is that?